So today I'm going to be looking at where did our current idea of how bodies work come from, and with a clearer idea of how bodies do work, was there actually something we could do about it when they didn't work? Because I hope you've noticed that up till now, that's the big gap that we've got. Medical people are finding out more and more about bodies, how they work, how they don't work. But they're not really finding out what you can actually do about it if they don't. So this week, they're about to come a bit closer to that. Next week and the week after, it'll definitely be on to what we can do about it. So we're still on the finding out bit here. So I'm going to talk not the most, you might say, fascinating topic, organs, tissues, and cells, but nevertheless necessary to know about. And in looking at these, we're going to talk about postmortems, looking at the body after death, examining it, and vivisectionists again. In other words, the looking at live bodies, although animals, not humans. But again, we'll come to the problem of saying, if we know how an animal body works, is that actually telling us much about humans? And we'll see it does and it doesn't. Okay, so just to remind you about how I left it, remember those rather strange pictures from the other week. We had the two mass murderers here, Burke and Hare, who were murdering people in their own cunning way that didn't show any signs on the body, and taking them off to Dr. Knox's anatomy school, where Knox, there he is, played by, I've forgotten his name, the actor, making a lot of money out of anatomizing bodies in front of all the enthusiastic students with their notebooks there, you can see. Well, that system, as we saw, panicked people because they were worried that their bodies were going to be stolen and taken off, if not murdered, and taken off for the anatomy schools. But if you also remember, by the 19th century, beginning of the 19th century, criticism was beginning to appear about how useful this whole system was at all. So if that wasn't so useful, remember the first editor of The Lancet, which is still a journal, you can see it up in the library today, or online, it's obviously online. The first editor, remember I told you about last week, Thomas Wakeley, said this kind of thing is rubbish. All it's telling you about is random bodies, and we don't know what was the matter with them before they died. It's telling you nothing that you don't know already. It's like reinventing the wheels, doing the same thing over and over again. If you want cutting-edge medical teaching, experience in medical surgery and medicine and surgery, where do you go? Where do you go if you're an early 19th century medical student? Remember, we've seen that medical students in general, like you, just like today, you choose a university or a place to go to, depending on what you want to study, and where you think you'll get the best teaching, and what looks good on your CV once you go out into the big wide world, as it were. Well, where were this lot going to go? Where could ambitious medical students find cutting-edge teaching and experience in medicine and surgery? Where could they also find systematic clinical teaching? Aha, with hands-on experience. There's particularly the new one. Clinical experience. Not just experience on dead bodies, but experience on live bodies. Now, sadly, nobody is saying at the moment we can actually cure these bodies. Probably we can't. But at least we can get some experience. So where are they going to go for this? Well, the most unlikely place you could actually have thought of, Paris. So you might think, but what's wrong with Paris? I'd love to go to Paris. Well, not at the beginning of the 19th century, you wouldn't. Let me tell you why in a moment. But against all expectations and counterintuitively, at the beginning of the 19th century, Paris was the hub for students. Students from the UK, students from Europe, students from America. Not so sure about students from the East. We don't have a lot of evidence of that. You can't say, of course, there were students from Australia, because Australia as such didn't really exist at that period. But we do know that a lot of the early doctors who practiced in Australia in later years had actually been trained in Paris. And they used that as a sort of hook to get the patients in. We have extra good experience, they said. We trained in Paris, not just in any old place. Amazingly influential on America. A lot of American students went over to Paris. In fact, they were blamed for stirring up the revolutionary fervor, as we'll see in a minute, because, of course, America had just had its revolution. The French Revolution was made worse, they said, by these medical students who came over and stirred things up. Well, a bit of an exaggeration, but still. Here's the Palais Royal, which you can still see in Paris today, part of the center of Paris, where these medical students went to. Okay, as well as that, we'll look at the origins of the stethoscope. The stethoscope is about to become the new symbol of medicine. Initially, it's the symbol of Paris medicine. And as we'll see, initially a stethoscope didn't look like the one in the picture here. We'll see what it looked like. In fact, what's happening here is a paradigm shift in a way, but certainly a shift of generations. Here's the old medieval physicians looking into their urine flask. Remember that? That was a sign, the rather unlikely sign of medicine. If you depicted people like that in a picture, looking meaningfully into the flask, that meant that they were medical practitioners. Now, from now on, and even now, you notice on television or anything you watch online or whatever, if they want to give you a shorthand that this person is a medical person, they'll have a stethoscope draped around their neck. I could almost guarantee it. So how did it shift from that to that? We'll see. It was in this period. Okay, moving on then. We're also going to look at why early animal rights campaigners impacted on medical research, because they certainly did. Here's a picture of William Harvey's, some of his early experiments on animals. You can see this poor wee animal here, presumably dead by this stage, kind of pegged out and having some of Harvey's blood circulation experiments done on him. The vivisections performed by William Harvey on animals, however, by the 19th century were not nearly as acceptable as they had been in the 17th century. Two reasons. One is far more people knew about them, which is often the reason for more agitation about things. And secondly, there had been a change in the attitude to animals in general. Can't really blame people back in the 17th century. I mean, life for humans was difficult. So they weren't really terribly sympathetic about difficult life for animals. By the 19th century, you might say things had got a bit more civilized. So we'll see how that impacts on medical research. And of course, we still have that as an issue today, obviously. All right, so off to France. Although if you wanted to go to France at the end of the 18th, beginning of the 19th century, you might be forgiven for thinking that it certainly wasn't the most welcoming place. Although, and we know this today, don't we, from reports in the press, sometimes you get the impression that in some places, countries, areas, it's nothing but fighting and brutality and horror. Actually, sometimes you find it's in quite specific bits. It isn't actually all over the place at all. Likewise in France. There were bits of France that were still fine, but certainly there were bits that weren't so fine. Here's a picture of some of the revolutionary armies here, right in the center of Paris, the tricolore, the new French flag. We'll see what it was representing in a minute or two. So the French Revolution is on the go, with their motto, you might say, their statement, we would probably say these days, of liberty, equality, fraternity. Freedom, equalness, brotherly, as they would have said then, although also sisterly, comradeship, as it were. Didn't always work, of course. But what it did do, and we're still living, of course, with the results of this today, is the secularization of the state. So France becomes, instead of being a Roman Catholic country, with the king at its head and the Pope as kind of overall overseer, as it were, it becomes a completely secular state. Well, it doesn't, but in theory it does. So supposedly the church and the king and the aristocracy haven't got much influence on French society, and how that affects medicine we're about to see in a minute. So what were the changes in the structure of society? Because society always affects medicine and healthcare. Well, there was the fall of aristocratic and church privilege. In other words, they're not the ones in charge anymore. The aristocrats, and we can see an unfortunate picture here of some poor person being dragged to the guillotine. Many of them had their heads cut off, supposedly humanely by the guillotine. You put the body on this plank here and kept the head still and then brought down that cutting instrument, shall we say, on the head, as it were, and then the head rolled into a basket, and the executioner held up the head to show that the person was actually dead. Weirdly, and just as an aside, this apparatus for death had actually been invented by a physician. And supposedly it was humane. Well, I mean, it was compared to what else they used in those days. It was quick. As long as the knife didn't stick halfway down, it was quick. And weirdly, they also used it for vitalistic experiments in this period. Doctors, physicians used to stand round the bottom of the guillotine here, around there, they could get to them for the people with the guns, and watch to see if there was any sensibility left in the head after it was cut off. In other words, how quickly did that happen? And of course, now we know there are automatic sort of opening and shutting of eyes and things like that. The conclusion they came to was actually this method might not have been quite as humane as they thought. However, more importantly, the revolution led to the rise of the secular middle-class professionals. Here we get the growing middle class, the rising middle class, so favored of history. And this makes a difference to every society. Every society that has a middle class changes as soon as it gets one. It's no longer the aristocracy and the poor, it's another lot in the middle. Another lot who are interested in bettering themselves, in getting better education, in getting more money, in living in better houses. They don't inherit them like the aristocracy does, and they're not too poor to bother like the poor are. They want to lift themselves up, be upwardly mobile. They're always like this, are the middle classes. And amongst the middle classes are the physicians and surgeons. Surgeons, remember, thanks to Paré a couple of centuries ago, remember we talked about him a few weeks ago, surgeons in France have got a better reputation than they have in many countries. They're actually educated, unlike some places. So the physicians and surgeons have been part of the revolution. Little did they know what they were bringing on themselves, but still. Why? Because they wanted to rise in their professions by ability, not by patronage, as I've noted there. What's patronage? Patronage is where you had to have a patron, like a nobleman, or even the king, if you were very lucky, like William Harvey did. And that helped to raise your status, it helped to get you patients, it helped to get you hospital positions. This is ridiculous. This is the 19th century, said the physicians and surgeons. We don't want to have patronage. We want to be able to rise on our own qualifications. So inadvertently, they'd actually helped to produce this revolution, which overturned the whole strata of society. So how did this work in practice? Here's how it worked. The revolution set up what they called schools of health, attached to the hospitals. They didn't do it, the hospitals were still there, large hospitals, often with Roman Catholic nuns as their nursing sisters. I think you can see some of them here. There's at least one with there. So the hospitals are kept in place, but added to them, they're called écoles de santé in French, but schools of health is what it means, where people can be trained. But at the same time, because it's attached to a hospital, here's a new idea, they can get practical experience. So it's not just theory, it's practice, hands-on practice with the patients, and we'll see why in a minute, why that was so easy. Here's obviously a very set-piece kind of picture that was painted at the time in order to glorify Napoleon, who comes to the throne towards the end of the revolution. He becomes the emperor. Here he is, a bit like the Queen today or someone like that, doing the rounds of the hospital. They'll have a tidied up patient in the bed here who looks nice and clean and respectable. So Napoleon is no doubt saying the right kind of royal things to this poor patient who actually doesn't look very well, really. He's having to be supported there. He's got all his entourage with him, and they're going around the hospital to see how this new system is working. So obviously they'll be sending them to the best place and telling them all the most positive things. So they're set up under the, you might say, the banner of order and reason. It's all very organized and reasonable. Well, let's see how that worked in practice again, and I'll tell you in a minute why I'm showing you a picture of beer barrels, which might seem a bit odd. Okay, so these were huge hospitals. Who were the patients in them? They were poor people. Unlike the UK, where we've been before, where they had small hospitals with actually slightly better off people in them. These are massive hospitals, and they're full of very poor people, mostly suffering from things like lung diseases, heart diseases, pretty well incurable on the whole. But nevertheless, up till this period, hospitals have been like a religious institution where you look after the patient until they die. In other words, you're concerned with their soul, not their body. But now things are about to change. We're not really so fussed about their souls. The priests can look after them if there's any left. What we're really worried about is getting to use them as material for our training. So the poor patients' narratives are considered to be unreliable because they're poor people. Because there's a big gap in rank between the patients and the physicians and surgeons who are coming round. In this period, you don't talk directly to somebody who's above you in rank. And even if they could, they were considered to be inarticulate. Probably they weren't, but they were considered to be. What's a patient's narrative? Well, that just means what you do nowadays. You go into your medical center, you go into whoever you're going to see, and they say, so, what's the matter with you? Or words to that effect. And you tell them a wee story, don't you? Oh, well, I've got this pain, and I've had it for a few weeks, and blah, blah, blah. And that's what they go by to begin with. But these patients weren't trusted to do that. They thought they were too stupid to be able to do that. So there was a need for an extensive physical examination. And bear in mind that any better off patient wouldn't have put up with that for a minute. A physical examination simply didn't happen, particularly if this was a lower class physician or surgeon and you were an upper class person. They weren't going to touch you, were they? You might think that might be a bit counterproductive, but nevertheless. So the need for an extensive examination led to the inventum novum. Latin, they're still using Latin, notice, not French. The percussion of the chest. And of course, in some cases, although not so much these days, doctors still use it. It's where you tap the chest or the back, sometimes, to hear what's going on. So you go tap, 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 and you listen. That's going to tell you, in theory, what's going on inside. You can't see what's going on inside, but with any luck, the tapping, the sound of the tapping, like you tap on a wall, and you can tell if it's a hollow wall or if it's a built-up wall. Where did this idea come from? Well, this was the beer barrels. It was well known by owners of inns and places like that you could tell how full the barrel was of beer or wine by tapping it. And the tap told you whether it was full, half empty, or completely empty. So fluid on the lungs, as you would have in heart disease or lung disease, you can by tapping, you can tell that's there. So this was one method of trying to get to what was the matter with these patients without actually having to ask them. This was referred to as immediate auscultation. If you see that as a phrase, that's what it means, listening directly. So they'd tap and they'd listen. They'd tap and they'd listen. But, big problems. Big social and moral, we might say these days, ethical issues. You didn't really want to touch lower class people who might not be all that clean, quite frankly. So if you could get away with not touching them, so much the better. There were also gender issues. This is almost inevitably a male surgeon or physician. A lot of the patients are female. Is this ethical to put your head either on their chest or even their back? Not really, even given the issue that the patients had no choice whatsoever. So there's a problem here. It's a good diagnostic tool, but there are ethical issues. What's going to happen? Aha! Along comes this bloke, rather unlikely looking inventor, but nevertheless. His name's Rene Laennec. You can see his dates, didn't live very long. The poor bloke had what we would now call tuberculosis. You can see he's not looking very well there, is he? Sort of hollow cheeks. But incredibly influential. If you've never heard of him, you should have done. Sorry, his first name, Rene, should have an acute accent. My computer doesn't talk French, so sorry about that. Rene Laennec, what does he do? He gets a really good idea from rolled up paper. This is such a kind of old wives' tale, no, not old wives' tale, urban myth from medicine. But it could actually be true, as so many urban myths are. What did he do, supposedly? What he did was, he thought, how can I listen to this patient's chest or their back without actually putting my ear on it? Aha! Old children's game. You know, you put your ear to something and put it to the wall and you hear more closely. What if I just rolled up a bit of paper, he thought. I put my ear one end, put the other end on the patient's chest. I'll actually get magnified sound, and I won't have to be very close to them. What a great idea. So, that's what he uses for a little while. He refers to this as mediate. In other words, mediate with something between you and the patient. So not immediate, but mediate. Immediate doesn't mean right away. It means that you're really close to something. So mediate auscultation, you can hear auscultate from ear, the Latin word for ear, using the stethoscope. Aha, a new word. It didn't look like we imagine it today. It was, in fact, a bit like a telescope. Around, when he eventually got them made, not just bits of paper, it looked a bit like a telescope that you put to one ear and you put that on the patient. I'll show you some pictures in a minute. But did that mean just because he could hear better what was going on in the patient's lungs or chest? Was there any change in treatment? No. Still haven't got to any change in treatment. Identical to the Hippocratic stuff. In fact, in the Paris hospitals, they went berserk on the bloodletting. They thought the more blood you let out, the better. More purging. The more the better. Let out the evil humors. It was still on that kind of system. So on one side, we're getting more and more modern. On the other side, it's still very much the old-fashioned method. So just let me show you a couple of pictures before we move on. Oh, sorry, one more bit. So what happened here? What happened was that the doctors and surgeons would come in to the patients, who are all there lying in their beds. They would do an examination, probably with the stethoscope. Would they have any treatment? No. Did the patients die? Yes, unless by any chance they got better by themselves. Once they were dead, what did they do? Did they just send them off to the mortuary and then bury them in a mass grave? No, they didn't. They were useful. This is exactly what Thomas Wakley said should happen. You should have a patient on your post-mortem bed, for want of a better word, that you've seen before they were dead. So in other words, you can correlate the symptoms. You can have examined them thoroughly when they were alive, looked at their skin color, listened to the chest, seen if they've got any rashes, any coughs, anything like that, made copious notes of all of that. Then they'll die, of course they will. You'll take them off to post-mortem, you'll open them up, and you'll look and see what they look like inside. Aha! There has to be a connection between exterior symptoms and interior lesions. And in fact, unbelievably, they did actually manage to correlate some. So that way, you're building up a picture of disease from the external to the internal, with a patient that you know, not just some poor old person off the street who's been murdered, who, quite frankly, is not much help. Okay, moving on then. Here's some pictures just before we move on to the next stage. Here's possibly Laennec with his tube in his hand, in other words, the old kind of stethoscope. And this patient doesn't look as if he's long for the world at all, but nevertheless, he's going to be examined. We can see here that they still have the Roman Catholic sisters as nursing sisters, so they didn't get rid of them. And here's a rather fanciful picture from a few years later on, but again, it's still, he's listening to this little boy's back. He actually looks as if he's gone to sleep, but we hope he hasn't. He's no doubt thinking meaningfully about the sounds that he's hearing. So you can see that by a few years' time, GPs, as we would call them nowadays, were using the stethoscope. And it wasn't long before it was the one that you put in both ears that became so much the sign of medicine. Okay, so moving on then. What happened at the post-mortem examination? What they did was they examined the bodies, once they'd opened them up, at tissue level. The fabric of the body, what we now call histology. They looked at the different kinds of tissue. You can see different versions of it here: connective tissue, epithelial tissue, muscle tissue, etc., etc. They examined them for changes that would correlate with the changes of the symptoms when the body was alive. They discovered at this period 21 types of tissue, which was pretty good, really. Pretty good research. And as I've said, they looked for pathological changes in the tissues, internal lesions. They were noted. So this was a pretty careful kind of study of the body. It wasn't just cutting it up and looking at it inside and removing a few organs and then sewing it back up again. This was actually diagnosis. And what allowed this to be a real research project was the large number of bodies that were involved. Huge numbers of bodies. I mean, that's not good in its way, is it, that so many people died? But nevertheless, you could only do this on a large scale. You could only tell what was normal or abnormal by looking at really large numbers of patients. Otherwise, it could simply be an individual idiosyncrasy. You had to know whether it was a general one or not. However, and here's the amazing thing, they were still doing this without microscopes. Nobody used a microscope for this kind of stuff. They were doing the examination with the senses, looking. It wasn't until mid-century, as we'll see a little bit later on, when microscopes actually became useful. In fact, in this period, they wouldn't have been useful because the magnification wasn't good enough. There weren't enough of them. But it wasn't just that. It was the whole idea, same as Harvey, that if you were examining a body, a living body, you looked at it with your living senses. And an instrument was seen as simply getting in the way, not as helping at all. They had to get round that mindset that an instrument was going to be useful. They got round it with a stethoscope, but they've still got to get round it with a microscope. Okay, moving on quickly then. So, after that lot, Laennec and his fellow surgeons and physicians in the early French hospitals, French medicine still tends to be on the cutting edge, and you still want to be there if you want to get the best training. The next generation after that is a rather uninspiring man in many ways, called Claude Bernard. He was the next generation of French doctors. You can see his dates there. Lived through the middle of the century, as it were. He was rather unusually, and this is important because it affected what he did or didn't do, a university professor without hospital position or patients. That would be very, very unusual in a medical faculty today. Almost all the staff, the faculty, would have conjoint positions, as we call them today. In other words, one in a hospital, one in a university, because they're seen to need practical experience. Did Bernard have that? No, he didn't. He had university qualifications, but you can see his robe here. That's why he's painted in it in his younger days. But no actual patients. Actually, it turns out probably just as well he didn't, as we'll see. He also, and you might think this is completely unimportant, but it's not, he had a very disapproving wife and daughter. And as he did a lot of work in the basement of his house, his private dwelling place, we'll see why that was a problem. But he's very influential, very. Let's see why. Because basically he set up what we refer to as the experimental method in medicine. I would have to say this is not one of the more interesting topics in the history of medicine. It's seriously not. But it is very important because we're still living with it today to a certain extent, the way of doing medicine. Rather than simply being a hands-on art, it's now almost tipping over into being a hands-off science. And Bernard's pushing it in that direction. He's setting up pure laboratory science with vivisection. In other words, he's back to the Harvey thing of looking at the animals, looking at inside them, trying to work out what's going on, and then relating that to human beings. Here's Bernard in his older days, as you can see, cutting up some animal or other. He didn't really have students exactly. It was more that he had people who came to watch him do his work. So let's see what he did. He said, these are all sayings from his book. He wrote a book, of course he did. I'll tell you about it in a minute. Observation is the only reality, he says. So you don't philosophize, you observe. And what did he observe? The animals. He did this by induction and deduction. I'm sure you're familiar with that sort of idea. You start off with an idea and then you go from there, or you start out just looking generally and then you come to an idea at the end. One or the other. Methods of science, both methods of science, both perfectly reasonable. He also said there was causation and chronology, and you had to distinguish between the two. Please notice that a lot of people who talk about science and medicine today apparently can't do that. They seem to think that something that happened at the same time as something else actually caused it. No, says Bernard, you've got to be really careful about that. You can be fooled, but it isn't always the case. And he said theories are only hypotheses to be proved by fact. Another thing that people seem to have missed today. Science is always just theories, always waiting to be proved or disproved. It's never firm. It's always on the move is science. And Bernard is recognizing this. And he's saying that you do the verification of your theory by disproving and replication. So here's the scientific method that we recognize. You have a theory, you try to prove it, you do things to prove it, you write about it, and you make sure that somebody else can do it in exactly the same way, so that it's a genuine way of doing science. Okay, so he publishes his book. Of course he does. His book is called Médecine expérimentale. Fascinating title. Just means experimental medicine. So his book is called, sorry, it's a bit small to see maybe, Introduction to Experimental Medicine. I've got it down the bottom of this so you can see it in a minute. In that he talks about the milieu intérieur. In other words, the internal environment of the body. What does he say? He says, and we're not very happy with this today, you'll note with all the advice we get about health. He says the body inside, the internal body, is stable and resistant to the exterior environment, unless it's affected by physiological disturbance. In other words, he's saying, that's why we are all still here today. If our body, if the internal workings of the body were affected all the time by the exterior, we'd all be dead. Of course it can resist, unless we're sick for some reason, unless there's been some physiological impairment, in which case maybe we can't resist the infectious disease or whatever it is that's out there. We'll talk about this more in later lectures. He also, and we won't talk about this much here because it's not really very important, he again brought in, notice, the old Hippocratic Galenic idea of miasmas, or poison for contagion, which just means infection. So he basically didn't have an infectious diseases theory at all. It was all physiological. All disease was an impairment of the internal organs. He just couldn't really cope with the infectious thing. We'll talk about that in later lectures. And finally, here's the book, Introduction to the Study of Experimental Medicine, which he published in 1865. As you can see, not exactly a bestseller, although people who were interested in this kind of thing obviously bought it and read it, but far more influential later on, not so much at the time. Okay, so how did that move things on? At the time, not all that much, to be perfectly honest. Unfortunately, and here's where you have to keep this in your head, he was doing this work at the same time as the early bacteriologists were doing their work. In other words, at the same time as germ theory was coming out. And that was much more influential, as we'll see next week. So a little bit on the back burner, this work, but very influential later, as we'll see. However, how Bernard could have got his work much more high profile and perhaps accepted quickly would have been to do a bit of international research and cooperation. It was perfectly possible to do that in the middle of the 19th century. Communications were better. There were trains. There were journals that were published in different countries, in different languages. There were medical conferences that you could go to. So perfectly possible. Did he do that? No. Why? We'll see. Here's this bloke. He's the one he could have worked with. Rudolf Virchow, that's how you pronounce his name. He was in Germany. I've got Germany in quotes because Germany as such didn't actually exist then. It was just a collection of states. Unification didn't take place till the end of the 1860s. But he was in what we now call Germany. You can see, different kind of person, rather cheerful actually. Apparently a very popular man. Why would he have been good to cooperate with? Because he had the thing you needed to have by the 19th century, late 19th century, conjoint university and hospital positions. That was the gold standard. That was what you needed to have. And he was doing work very similar to Bernard, but he was getting much more attention paid to it. He published a book too, actually, before Bernard's, called Cellular Pathology, which was a lot clearer in its title. Not the most exciting title, I know, but at least it let the readers know what it was actually about. And they were talking about very, very similar things. Two differences. One was that Virchow actually called the little things that he'd found cells. Notice they've gone down from tissue level to cell level. And he called them cells. Bernard didn't call them cells. He called them units. Why didn't he call them cells? Well, for a start, he couldn't see them. Because Virchow was the one who was looking microscopically. This is now a phrase that is on everybody's lips, at least everybody who's anybody and wants to be anybody in medicine in this period. It's no longer an optional extra to look through a microscope. There are many pictures that I'll show you next week of people looking meaningfully down microscopes. It's a sign, even if you've no idea what you're looking for, it's a sign that you're on the cutting edge of medicine, and this is where Virchow is. He's in the universities, and he's got students. He gives lectures. He's apparently amazingly popular with his students. And we all know, even nowadays, that if you've got a good idea, you pass it on via your students. Okay, moving on quickly then, just to finish off. So, improved diagnosis and treatment? Actually, no. Sadly, despite all the books, or despite all the work, we're still not down to much in the way of treatment. Diagnosis? Well, You see, you'd think you could look through a microscope, look at cells that weren't behaving themselves. like from a sample of tissue from the body, and think, oh, even if I don't quite know what it is, there's something funny going on there. Sadly, it doesn't always work. And it actually had a very strange effect on politics in this period. Towards the end of the 19th century, Virchow has a royal patient. The Emperor Frederick, you can see him here, he grew the beard deliberately because he actually had throat cancer. And he had to have a tube put in his throat so that he could breathe properly. So he actually always had a beard, but he grew it even longer. So it covered this stoma in his throat. Very high-profile royal person. He was the emperor of the newly united Germany, and he was son-in-law of Queen Victoria, who was the big cheese in Europe in that period. What happened? Some of his tissue samples were sent to, well, probably not Virchow himself, but at least one of his students, to have a look at, because it was suggested that the poor man had throat cancer. He'd been a very heavy smoker. Who knows whether that had anything to do with it? It might have done, might not have done, but anyway. Virchow looks, or his student looks at this and doesn't see any problem, and sends back saying, no, the emperor's fine. Obviously just a bit of a sore throat. He'll be fine. Sadly, of course, he wasn't. It was throat cancer, and he died fairly quickly. He only got to be emperor for about 18 months. He died, did poor old Frederick, and guess who came to the throne after that much earlier than he should have done? Kaiser William, the one who started the First World War. So there's always talk in medicine that if only Virchow had diagnosed the emperor properly, maybe the First World War would never have happened. Of course, that's not true, because even if he had diagnosed him properly, there was no treatment, even for the emperor. All you could do was cut bits out of the throat, and of course there's a limit to how much you can do that without causing horrible trauma. So actually it's a non-question in this case. However, faulty medical treatment has caused First World War. Plainly not, but it makes a good story. All right, very quickly, just back to the vivisection. So they're still using animals for all this research, but things have changed. It's the end of the 19th century. People are looking on animals differently. Either they're the noble, like the stag at bay. Of course, you're going to shoot it, but it's a noble opponent. That's the idea. It has a go, and it can run away if necessary. Or sentimental, the faithful pets, this kind of idea. So using animals in research, in physiological research, is very, very, very unpopular. An anti-vivisection movement starts up by the end of the 19th century, interestingly connected with feminism. It's a strange connection, but somehow or other in the mind of 19th century feminists, they get the idea that perhaps they're being treated a bit like animals. I would say most of them weren't, of course, but nevertheless it was an interesting argument. And unfortunately, just for my last very quick doctor for this lecture, a physician doctor called David Ferrier, who'd been doing experiments on dogs and monkeys, actually on their brains, not so much on the rest of their body, came along to an international conference in London towards the end of the 19th century and brought his dogs and monkeys with him. This was very, very, very bad timing, because by this time everybody was sympathetic with the animals, not with the researchers. The dogs had kind of parts of their heads scraped away. You could see into the brain. It was all very, very unpleasant as far as the end of the 19th century was concerned. It was very useful research for brain function, but it wasn't seen as something that you should be showing people that you were doing. Funnily enough, people don't mind if they don't see things, but if they actually see it, it was very bad timing. There were women activists against vivisection. As I say, they thought there was some kind of idea that they were all being somehow or other put in a bad position. There was the, what did that stand for again? British Union Against Vivisection. That's what it is. This rather scary-looking woman here was the founder of the British Union Against Vivisection, against using animals in medical research. And back to Bernard, because you maybe thought I'd forgotten about his wife and daughter, who were disapproving. There was a very popular book, I think, oh, it was a short story that was published at the end of the 19th century called The Vivisectionist's Wife. And it was supposedly based on the wife of Claude Bernard, who had vivisected so many animals that you would have lost count of it. Supposedly in this story, the wife who's living above the evil laboratory down in the cellar of the house, which is exactly how Bernard's house was set up, she and the daughter supposedly crept out at night and let all the animals loose from the laboratory where they were being cruelly treated. And the general opinion was that this was actually based on Bernard's wife, who actually left him, which is very unusual for a 19th century wife. So here was a big statement about they just didn't approve of this kind of thing. So, where have we got to? Physiology is coming on apace. Research is good. The likes of Virchow have got university positions. They've got students who understand the research into physiology. But it's only one side of the picture. It's only one side of working out how the body works. And it's also still not telling you how you can actually treat and cure the problems. So, next week, we'll be looking at rather maybe an unfortunate topic, but still, the horrible scourge of venereal disease and how, despite the fact it was a horrible disease, nevertheless, it changed the idea of what contagion infection was, and finally led into notions of what you could do about being sick and ill. Taken us a lot of weeks to get there, but we'll get there next week. All right, we'll see you all next week.